Thanks very much, Mustafa, and good afternoon, everyone. Delighted to be able to join the seminar series to talk about this project. I shall just try and share my screen, see if that all works okay. Okay, is that looking okay, Mustafa?
I think so. It's we're able to see the notes also, so it's not in a full screen slide share mode.
Ah, okay. Let's try again then. All best laid plans. We tested this literally about 2 minutes ago. Okay, let's try again. Sorry, Yvonne, bear with me a second. Any luck there?
Yeah, it's still the same, but yeah, it's fine. Because we're having we can see two slides, so it's not the one slide on the full screen, but it's fine.
Okay, let's just crack on without, otherwise we're going to delay things a little bit. Okay, so really happy to take questions at the end, as Mustafa said. So I guess I'm talking on behalf of a team of about 6 or 7 of us now that have joined this project that we started. Myself and a genetic counsellor colleague of mine, Naz Khan, dreamt up this project on the way back on a plane from the European Society of Human Genetics conference. So I've been involved in genomics education for a number of years now, and we worked out that we got on really well together, and we sort of worked out where could we actually begin to work on a project together that would actually make a difference. And this project was kind of born out of that plane journey. So and most of it was actually undertaken over the lockdown period, and we've taken it to further places over the last couple of years or so. So I'm going to talk to you in the next few minutes about how we've co-designed Gene. And for those of you that don't read Urdu, that's also written in Urdu there at the top of the screen. And this is a genetics app to improve understanding of genetics that we've co-designed with the British Pakistani community. Okay, so just to give you a summary of the areas that I'll be covering. So obviously I'm going to talk about this as a digital health technology case study. I'll explore the clinical lead in a little bit of detail, but obviously happy to take more questions on that at the end. Really focus on the user-centered co-design approach that we've taken during the project. And we're going to talk about some of the merits that we've found of using agile methodologies, and then finish off by kind of discussing how we can involve the British Pakistani community much more in the design of digital health technologies. Okay, so the first thing that I'm going to show you is I'm going to start off with an animation that's actually been created as part of the app. And this will explain to you a little bit more about what is a genome for those of you that are less familiar with genetics or genomics. And then I'll explain a little bit more about the project. So let's see if this video works.
What are genes? Where are they in our body, and what do they do?
We can't see the video. We can't hear. We can hear, but can't see the video.
Okay, let's try again, then I'll share the video. Can you see that now?
Yeah.
Okay.
Our genome is the term we use to describe all of the genetic material held in each cell of our body. Our body is made up of cells. Each one has its own copy of our genome, made from something called DNA. DNA has its own code represented by a series of letters. Genes are short sections of DNA that act like instructions. They are present in each and every cell of our body and help it to do things that keep us healthy. Each gene gives a very specific instruction, like to make a protein that carries oxygen around our blood, for example. We might get a gene that doesn't work as intended and can't give instructions to make a particular part of our body work correctly. Imagine our genes spell out a sentence like cat on a mat. If we change one of those letters, the sentence and meaning doesn't read correctly. For example, if we change the letter T, it reads car on a mat, which doesn't make sense. The same would be true in our body, and a particular protein might not work as intended.
Okay. Slides appeared again, Mustafa? Okay, so as I mentioned, this is a project that we've been undertaking and co-designed with the British Pakistani community, and that's the British Pakistani community up in this sort of Blackburn area north of Manchester. The project was pump-primed by a small amount of funding from Blackburn with Darwen Council, and in fact, they're actually still partners with us on the project to this day. A little bit about the background of the project and how it came about. Essentially, cousin marriages or close relative marriages are more common within the community, and therefore there's often increased risk of genetic conditions within the community. Compounded with that, attendance at genetics clinics is often found to be poor, and there's a variety of reasons for that. Quite often when you live quite a distance away from the genetics clinic, which is based in central Manchester, it can be quite an upheaval to get family members, to get small children with, particularly if they have learning difficulties, to the clinic. And also it's quite difficult, you know, it's quite a trek into Manchester finding parking, etc. So for various reasons, attendance can be poor. So the idea was that we could develop an educational resource that will be able to provide support through genetic counselling and information we could provide through the resource to help inform both marriage decisions and prenatal decision making, and particularly for families where they perhaps had an affected family member within the more distant family, or in fact perhaps if they'd already had an affected child themselves. So our overarching aim on the project was to increase the understanding of genetics within the community. And I'll talk you through just a little bit of detail over kind of currently how the referral process will work for genomics for those of you that are less familiar. So typically, if you feel like you might want to see a genetic counsellor or there's been a problem in your family, you may go to get referred by your GP to a genetics clinic. You'd then be seen by a genetic counsellor, and they would then potentially discuss some options with you. You may then decide to go through some sort of genetic analysis. So you might have a blood sample taken. This then gets sequenced. So either some sections of your genome or some particular genes would be sequenced, and this is done by a genomic technologist. We then get lots of sequencing information, so lots and lots of letters to analyze, and this is undertaken by a bioinformatician, and then typically their job is to work out the needle from the haystack, so try and work out which of the changes in your entire genome may be responsible for a particular genetic condition. And so then that information can then be analyzed by clinical scientists, and if there is a change in your genome that might be responsible for a genetic condition, that information can then be discussed with you as the patient with a genetic counsellor, and then they can discuss various options. And the whole idea of genetic counselling is about supporting informed decision making. So moving on to the details of the project in a bit more detail, as I mentioned, so I've worked closely on the project with Naz Khan, who's a genetic counsellor, Alan Davis, who's been involved very much in the actual development work of the app, Dawn Dowding, Narina, I've noticed on the call, and various others, including Mustafa, who's recently joined us on the project. So when we started to develop the project, we undertook 3 different separate areas of research. So right in the thick of lockdown, basically, we recruited 7 members of the community with a lot of help from Naz, who had built up strong relationships with the community through a public health outreach role that she'd been doing for a number of years. And I'll talk more about those interviews in a moment. We then also undertook a review of the relevant literature related to genetics and genomics educational apps and resources. And then we actually undertook a review of genetic apps. And so Narina and Amy, that have been part of the project, very much led on those 2 aspects of the research. And all of those 3 areas essentially fed into the app design requirements. And then we went through a prioritization process to work out how to prioritize those design requirements as we began to develop the app. So in terms of participant recruitment, this was very much driven by Naz, and that was using a lot of her connections with things like Home Start groups and various organisations within the community, health visitor workers and things like that. So as I mentioned, Naz had worked with the community for a number of years, which was an important point because she'd been able to build up trust and respect, and that had taken a long time to build up with the community. She managed to recruit 6 females and 1 male. And there were a mix of participants from those who'd been affected with genetics, either themselves through their own children, or some that had had no history of interaction with the genetics clinic at all. And that's important because actually those different perspectives are quite important for different reasons as we began to develop the app. So what's our approach to co-design been? I guess what I want to do in this next slide is talk you through where we did actually get aspects of co-design and in fact where we could have done a lot better, I think, on reflection. So as I mentioned, the participants very much fed into the requirements capture. We undertook some semi-structured interviews. We talked to them about things like how they'd used other apps, what they liked about apps, if they wanted to find out information about genetics, where they go to look for that, how they would use the internet, what information they trusted, what information they would want to know about, for example. We also involved them, once we'd worked out the content, we involved them in reviewing the storyboards, and I'll talk more about what that looked like later on in the presentation. And they gave feedback on the animations as we began to create those. And we went through an iterative process with that. So there were various areas where we think we could have involved them much more. Certainly we could have involved them in the design of the study in the first instance. And I think there could have been much more involvement in consent and patient information sheets. And even actually now we're starting to reflect and think about, could there have been alternative models of consent that we might have looked at that would have been less reliant on the written word? We went through a process of paper prototyping, and there were good reasons for that. And at the time, we were just coming out of the pandemic, so it's actually very difficult to get people together in the same room. So they weren't involved at that stage, but again, something to reflect on for the future. And we also have mocked up examples of clinical scenarios of videos that we've filmed with actors. And we created those scripts with Naz from her experience of being in clinics. But I think we could have involved them much more on the development of those scripts, which would have probably helped with adding to the authenticity of those clinical scenarios. So back to the requirements capture for the interviews, I guess to summarize the key kind of areas that came through. And I should mention the reason why these are color coded is this is according to the Moscow nomenclature. So we define the requirements according to red, color coded, we must have in our final design. Then we had orange, which we should have, could have, which were yellow, and green, which we won't have. And I should point out a lot of this decision making was also driven by actually quite limited funding that we had, and very limited funding to actually deliver the prototype of the app. So just things to summarize in the design, there was very much a feeling of people wanted patient stories, they wanted clinician videos and audio, they wanted things like drop-down menus so that it would reduce the amount of text they'd have to look at, they wanted icons they could click on for more information, they wanted pictures and animations of people who look like them, so wearing headscarves, for example. And there was some discussion around they wanted to see case studies and examples of other patients, but things that were potentially maybe not too disturbing, or children with quite severe disabilities, because they thought that might be off-putting. In terms of content, we about things like using analogies, and this is something NAS does a lot in clinic. So the example of baking analogies, where something's potentially missing in the baking, and therefore that affects the final end product, for example. NAS also uses analogies around prayer beads, which is quite interesting. They wanted to understand what risk meant. They wanted to understand things like inheritance and what recessive inheritance means. There was some description about religion, and we'll come back to that later on. And they wanted also some descriptions of some of the more common rare genetic conditions that this might lead to. Other areas that came up which were quite important that we took through into our final set of requirements for the app, things like NHS logo and branding. So that was really important. People felt that if it had the NHS logo, or indeed if it had the colour scheme of the NHS, that they felt that they could trust it. It was a credible source that they could go to and use. They wanted a clear link with a professional that they could go to for further support, and I'll come back to that point, because that was something that we actually chose not to do in the app, because there was reasons that would relate to impact on the service, and where that information would get directed to. There was an interesting point that came up around privacy. So we, in fact, decided in the end to not have anything too obvious that related to the app in terms of the infographic when you go into it in your phone, mainly because there was a lot of potential discussion in the interviews around the negative connotations sometimes within families if there was a genetic mention of genetics, or if you'd been looking at something to do with genetics. So they wanted to make sure that it would be private if someone else got into their phone, for example. And a lot of things around accessibility. So in lots of different languages, we've chosen to develop some of the content in Urdu, but we do know we'll need to look at other languages. They wanted the text to be large enough so they wouldn't have to zoom in on it. And then they wanted lots of features that you'd expect for it to be searchable, interactive, links to other web pages, etc. So the main things that we pulled through was that the participants wanted information provided by healthcare professionals who looked like them. They wanted it to be multilingual and very visually easy to see, lots of interactivity. That trust and link with the NHS logo and branding was really important. And privacy was important due to the stigma associated with genetics, certainly in some families. So then we went on to the next stage of the app, which was to undertake paper prototyping and actually to storyboard out some of the animations that we decided we want to represent some of those key concepts that we were going to have to get across in terms of content. And for those of you less familiar with this process, it allows you to rapidly iterate and generate an idea of how you can lay out your content, what kind of interactivity you'll have, how to increase engagement, how you might log into the app, for example, and things like that. So these were the three main things that we achieved through the paper prototyping. So we had determined, well, what's the content? How are we going to prioritize the content, and in what order are they going to see it in the app? How does that information present on a mobile device? So you start to think about, how it's going to be laid out, and then how you add that interactivity and make sure you can really increase engagement. So this was just to show you this is very rough and ready, but this is the kind of thing you generate. You can see on the left-hand side, we started to break down the content into conceptual areas there. It's difficult to see, but we had things like, what is genetics? What are genetic disorders? What does autosomal recessive mean? And then on the right-hand side there, you can see we've actually started to sketch out what will happen when you go into the app, what are the buttons of the app, etc. Something we've had to consider, I'll just put it for you to have a think about, and maybe we can come back to this in the discussion, but what makes an app rather than a web page? And this is something we've tried to think hard about, because you could just refer them off to a web page, and what is the value of having an app other than something that's obviously very portable on their phone, they can look at anywhere, and potentially without a link to the internet, etc. But obviously you're looking for something that is much more interactive, and rather than just sort of fairly static information, for example. So thinking about how we could add interactivity, we thought about what bits we could add interactivity to, which bits could be much more engaging, and how could this be achieved. So I'll talk you through some of the next sections in terms of how we've approached that. So one of the first ways that we've added interactivity or more engagement is to add some animations. And this was an interesting kind of process, because when we originally did the interviews, they said that they wouldn't want anything that was too cartoony, but something that that was visually appealing, that obviously helped to get across some of the key concepts. So obviously I've shown you one of the animations that was developed as part of the project. We worked with a company called Nifty Fox. That was an interesting process. We had to essentially teach them genomics, and they had to teach us animation. So it was a two-way. Every day is a school day, as I like to think. So basically, the process for anyone that's not been involved in creating animations is you statically storyboard out the concepts you want to get across, and that involved an ideation session with the animation team. We got across things like the stylization of the animation. So we wanted things that were not too cartoon-like and childlike, but something that was not high-end, too sort of so there was kind of a mid-ground of something that would be appealing to the participants. So we then got back these set of storyboards to review, and we went through these through various iterations. And then we also invited the participants, the original participants, to give feedback. And that was interesting because they spotted things that we hadn't spotted. So for example, I know it's quite small, but on the right-hand side, the comments there, you can see we've got this, the lady here that appears in the visuals, and she didn't have a scarf on every slide. And so there was something also about her face coloring that looked a bit wrong. So we corrected that. And they also spotted, on the next slide, you'll see the blood cells were actually, first of all, they were green rather than red. And I've just noticed the animation version that I showed you, rather than being a protein, I think actually has a neuron in there, and we actually corrected that. So there was various things that we had to work on and correct. The other thing they commented on, so you can see here's the errant green blood cell that appeared at some point or other in the animations that we corrected. But also they commented on things like the analogy that the cat on the mat. So that got sort of iterated on to make it more obvious over the analogy we were trying to get across there, of the letters in the sequence going wrong, and then that then causing something to happen. So other areas that we then got participant feedback on, we were able to then show, we built the app with the animation content. We added the videos that we've had, and you can see one of the examples, these on the right-hand side, with the actor that's pretending to be a genetic counselor. And we showed some of the prototype app to the participants again for further feedback. And there are a few things that came up. So first of all, to start off with, we had a flag at the top right-hand side of the app, which was the Pakistani flag versus the UK flag. And there was some contention around that. So we actually just changed that back to an English versus Urdu option. We've got the videos and the animations are in Urdu as well as English, but we need to also get all the other content translated. The participants, we'd drawn Alan, who's involved in the project. His daughter is a very talented artist, and she'd drawn this infographic for the front of the app. But the participants said that looked much more like a wedding-related image, so we've actually worked on that. They also commented there was still way too many words within the app, so we've had to reduce that text further. We had a section where it was very there was a Q&A section where they had to answer questions about if they'd had a family history of genetics, and that they thought there could be many possible answers to those particular scenarios, and it was too binary, so we've changed and worked on that. And also there was bits of the content where it wasn't quite right, and we need to look at that. So there's an implication in one of the videos that all of your DNA is checked, akin to something like an ancestry service, for example, but that's not actually the case. In genetics clinics, we will typically only be looking at the genes we think might be responsible for your genetic disorder. So there's a bit of work to do with a couple of the videos. So this just shows you how we've changed it. So this was obviously the one that they didn't like, which looked like a wedding. We've changed it to a much more family orientated infographic as you go into the app now. So that's what the first change. Second change, we've made this a little bit more interactive, so they can, there's a Q&A with options on the right hand side based on the participants' feedback. Okay, so what next? So we're in the process now of we've pretty much got a prototype ready of the app, and we've been prioritizing the changes that have been suggested by the participants from their feedback, and we've been finalizing that on Android devices. And really, our next step, we'd like to get that also onto iOS. However, we're now applying for further funding to take this project forward because we've pretty much really very much run out of the original seed bit of funding that we got to develop the project. And I think we brought the app a long way. So now we're looking at ongoing funding sources to be able to develop this further. We'd like to get more feedback from the community. We think we've had a lot of feedback from mainly females in the community, and now we need to focus on engaging with the males in the community to make sure we get a balanced view. There was things that came up certainly in the early stages of developing the animations where, so for example, the women that we had as part of the participant group said, you know, you need to make sure it looks balanced, so that in each of the animations we made sure there was a male and a female that were represented in the animations, because genetics, particularly for recessive conditions, is dependent on both the male and the female having a recessive genetic variant. And they felt that too often it was perceived sometimes within the families that the genetic change or variant can be passed through the female line. So there's lots of really important cultural reasons why it's important that we get some feedback from the males in the community too. We might do some observational studies or eye tracking to see where people are looking on the app, what bits of content they're really engaging with. We'd really like to do a small feasibility study now with 2 different sites. We've got the Manchester Rare Disease Centre very much on board with helping to disseminate the app, and we think would be a test site, but we'd need a second site to potentially compare between having the app and obviously not using the app. And the big thing we'll need to consider for a larger evaluation study, and certainly now NAS also works now for NHS England, so we have a good link into rolling this out into a national tool to be used, but we really need to consider how this would impact and be implemented into service, and then what's the ongoing impact. Obviously that the services are busy as it is, so obviously we just need to model and think about that and look at the health economics impact, and we're working with Martin Eden on that side of the project, and he'll be working with us on further applications as we put those in for further funding. And then the other big part of what we've learned is we need to look much more closely about ongoing co-design of the research materials with the community, and we'll be writing that in as part of another funding application to make sure we look at alternative ways of consenting people, providing patient information, looking at what works with the community and really co-designing that with the community from the beginning. So I guess to summarize that the main things that we've taken away from this project so far in developing this prototype app, certainly don't make assumptions for your end users. You need to ask them and involve them from the very beginning and keep asking them in a very iterative way, which we've tried hard to do. So we need to consider really in detail how we can lower the barriers to inclusion in research and health technology development. And I think we're starting to think in that direction, but I think we could have done much more probably in this project to involve them at all stages of that co-design process. We need to consider the cultural and the ethnic implications. So I said that I would come back to this, but one of the things that cropped up in our original interviews related to the involvement of religion and whether we should talk to imams, for example, about the genetic testing and whether there should be any mention of that within the app. Because there was quite a lot of disagreement within the participants, for now we decided not to do that, but I think that's something that we do need to come back to. And obviously I've mentioned the perspectives from the male female perspectives that also came up during the participant feedback sessions. The big point we've also learned is content creation is really expensive. To create those 4 animations that we've got in the app, I think we've paid about £10,000 for. We did get some additional funding from Blackburn to fund those, but it's really expensive. So that prototyping and involvement process is really, really important because you can't afford to get those wrong. So it's important to get that before the animations actually get animated, because it's much harder to go back at that stage. And then the final point really is to consider the patient pathway and the impact on the service delivery and obviously the health economic side of things, which is, as I've already alluded to. So that's really as much as I wanted to talk about the project. We're really excited and hoping to take this forward into a research for patient benefit call later in the year, which we're working towards. That's my email address if you'd like to reach out or chat about it. But other than that, I'd be really happy to take any questions. Thank you.
Great.